Okay, so before I would start the exam, I would make sure that I have all my equipment ready and gathered so that I can reach it quickly. I would have my stethoscope, an ophthalmoscope, an otoscope, a visual acuity chart, tuning forks if needed, reflex hammer. Today I'm going to be using my stethoscope, cotton swabs, an alcohol swab, a toothpick for touching sensation, pen light, a watch with a second hand sanitizer, and a pen and paper for taking notes. And also, if vital signs were not previously done, I would have a blood pressure meter, a thermometer, and a scale. All right, first I'm gonna clean my hands. Hi, Nicholas.
Hello.
I'm Andrea. I understand that you're here today for your yearly wellness check.
That's correct.
Great. So we're going to do what's called a head-to-toe exam. So I'm going to kind of go over every part of your body. We're going to change positions a few times, so I'll walk you through everything. This is going to involve me looking at you, touching you a little bit, palpating, and listening to some areas of your body with my stethoscope.
Okay.
Do you have any concerns at all today?
Nope.
Okay, are you experiencing pain anywhere right now?
Nope.
Okay, so first I'm just gonna kind of generally, look you over, kind of look at your skin. And whenever I'm touching you at all, just let me know if you have any pain anywhere, okay?
Okay.
Just gonna look at your back here. Okay, I'm just gonna touch your face. Any pain when I'm touching you here?
Nope.
Good. Any pain in your head at all?
Nope.
Okay. All right, so you can look straight ahead. I'm gonna look into your eyes with this pen light. Great. And so next I would use the ophthalmoscope to look into your eyes. Okay, I'm just gonna look at your ears here. Then I would use the otoscope to look into the ears. Can you open your mouth for me? I'm just looking in. Great, can you lift your tongue up? And can you smile for me? Good. Great, okay, I'm just gonna look at your nose. And I'd also look in the nose with the otoscope as well. Okay, so I would test the olfactory nerve if I thought it was a problem. Do you have any issues with smelling that you feel like?
Nope.
No? Okay. All right, so next I would check vision with the Snellen chart. And now I want you to follow, just with your eyes, my finger, okay? Good. And then can you clench your jaw for me? Like make your jaw tight. There you go. Okay, and close your eyes real tight. Try not to let me open them. Good. Raise your eyebrows up. Can you puff your cheeks out? And show me your teeth. Good. And stick your tongue out and say ah. Good. I'm not gonna check your gag reflex. Right now I'm gonna check your hearing, okay? So I'm gonna kind of make some noise over here and I want you to tell me, I'm gonna say 3 letters and tell me what you hear.
A, B, C.
Okay. I'm gonna whisper 3 other things over here.
4, 5, 6.
Great. Okay. Now I want you to, I'm gonna put some resistance on your shoulders and shrug your shoulders for me. Good. And then I'm gonna touch your face and try to turn your head towards my hand. Good. And then the other way. Great. Okay. I'm gonna feel your neck now, so just kind of tilt your chin up a little bit for me. Good. Just feeling for your lymph nodes. Okay, I'm gonna feel your trachea here, and sometimes this can kind of tickle your throat. Good. I'm just gonna feel your thyroid from the front. Can you swallow for me? I'm just gonna touch your back here. Any pain anywhere?
Nope.
No touching? Good. Just looking at your spine. And then take a deep breath in for me. And out. And one more deep breath in. And out. Good. So I'm gonna tap on your back just to hear some noises here, okay? Okay, I'm gonna listen to your lungs here. So I want you with your mouth open wide. Sorry, just normal mouth open. Just take some breaths through an open mouth, okay?
Okay.
So nice, slow, deep breath in and out. Good. Okay, a couple more here. One more. Okay. Okay, one more thing before we lay down. I'm just gonna look at your arms here. I'm gonna kind of test your joints out. Any pain in your shoulder when you lift it out like that?
Nope.
Shoulder okay on this side?
Yep.
Any elbow pain?
Nope.
Any wrist pain?
Nope.
Good. Okay, so I'm gonna hold your arm like this. I want you to pull your arm up towards your face. Good. And then push your hand down. Good. And then we're gonna do the same thing this side. Pull your arm towards your face and then push it away from you. Good. Okay, so I'm gonna have you lay down here, Nick. You can kind of lay at a little angle there with that pillow behind you. Okay. And then I'm gonna have you touch my finger and then touch your nose, and I'm gonna move my finger all around, okay? So it's gonna go kind of fast. Sorry, I moved it too fast. Okay. Next, I want you with your hands, touch your thumb to each of your fingers as fast as you can. Good. Okay, you can relax your arms, and I'm just gonna touch your chest here and let me know if you have any pain anywhere. Any pain at all?
No.
Okay. Good. So I'm gonna make the tap on your chest again, okay, to listen
Okay.
to some noises. Okay, then I'm gonna listen to your lungs again. So same thing, open mouth breathing, nice slow deep breaths. Okay. Okay, I'm just gonna feel here. Okay, I'm gonna listen to your heart now, so just so you can breathe normally, okay? Okay. next thing I'm gonna do is I'm gonna listen to just the sounds in your abdomen, okay?
Okay.
Does this tickle?
Yeah.
Sorry. Okay, I'm gonna make that same noise where I kind of tap on my fingers on your abdomen in a few places, okay? Okay, so now I'm going to touch your stomach. First, I'm going to touch it lightly, okay? And let me know if you have pain anywhere. Sorry if this tickles too. Any pain at all?
No.
Okay, I'm going to press a little bit deeper. Okay, can you take a deep breath in for me? And one more. Good. Okay, I'm gonna press a little bit deeper here. Just kind of feel for any pulsations. I'm gonna grab a little drape here. I'm gonna feel for the pulses, just right in your groin, kind of right under where your band is of your shorts, okay?
Okay.
I'm gonna feel for some lymph nodes too. Do you have any pain at all?
No.
When I'm palpating here. Are you comfortable right now? Are you?
Yeah.
Okay. Okay, I'm gonna bend your knee a little bit. I'm just gonna feel for this pulse behind your knee. And same thing on this side. Okay. Feel for your pulses in your feet here. It's recording. Okay, I'm just looking for any swelling here. Okay, I'm gonna press down on your leg. Try to lift your leg against my resistance here. Good. And other side. Good. And then press your feet against my hands like you're pushing on a gas pedal. Then pull your feet up towards your. Good. Okay. So next I'm gonna test your sensation. Okay, so I'll have you close your eyes. And this is what the sharp object feels like. Okay. And this is the light object.
Okay.
Okay, and I'm gonna kind of start from your face and work down, and just tell me if you feel sharp or dull.
Okay. Sharp. Sharp. Dull. Sharp. Sharp. Dull. 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 Sharp. 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 Dull. 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 Oh, sharp. Sharp.
I'm gonna press harder.
Are you saying dull? Or is it soft?
Yeah, you can
Dull.
say soft.
Dull. Sharp. Sharp. Soft.
Alright, that part's done. Okay, next thing, I'm gonna have you just swing your feet around and just sit up. I'm gonna test your reflexes in your knees, okay? Okay, next part, I'm gonna have you stand. I'm just gonna look at the back of your legs for any abnormal looking veins or anything. Okay, and then next thing, I'm gonna have you just walk over towards the windows and then turn around and come back. Good, and then I'm gonna have you walk that way and just walk on your toes towards the window. And then come back and just walk on your heels. Okay, next I'm just gonna have you stand there with your feet together. Good. Then I'm gonna have you close your eyes. And we would do this for about 30 seconds. Okay, keep your eyes closed and put your arms straight out for me. Okay. Okay, you can have a seat, Nick. So next I would perform the genital exam and then the rectal exam if indicated. So that concludes our exam today. Nick, do you have any questions or concerns about anything?
Nope.
Great. All right, well, you have a great day.
Patient is average height, middle-aged male who responds appropriately to questions. He is alert, oriented, and cooperative. Vital signs are within normal limits. Skin is normal in appearance, texture, and temperature. Scattered cherry angiomas and moles over upper trunk. Nails without clubbing or cyanosis. Hair is balding, scalp without lesions. Pupils are 4 millimeters, constricting to 2 millimeters, round, regular, and equally reactive to light. Extraocular movements are intact. External ear canals are normal. Hearing acuity good to whispered voice. Nose mucosa is pink. Septum midline, no sinus tenderness. Mouth oral mucosa is pink. Dentition good. Tongue is midline. Tonsils without erythema. Pharynx without exudates. Neck is supple. Trachea is midline. Thyroid isthmus barely palpable. Lobes were not felt. No lymph nodes were palpable. Thorax is symmetric with good excursion. Lungs resonant on percussion. Breath sounds vesicular with no added sounds. PMI in the 5th left intercostal space at the midclavicular line. Good S1 and S2 sounds. No S3 or S4. No murmurs heard. Breasts are symmetric. No masses. Nipples without discharge. Abdomen is protuberant. Bowel sounds active. No tenderness or masses. Liver span approximately 8 centimeters and right midclavicular line by percussion. Edges smooth. Spleen and kidneys not felt. Unable to palpate aorta. External genitalia without lesions. Rectal exam was deferred. Extremities were warm and without edema. Calf supple and non-tender. No edema in the peripheral. No varicosities in lower extremities, no stasis, pigmentation, or ulcers. Femoral, popliteal, and dorsal pedis pulses are 2+. No joint deformities or swelling on inspection and palpation. Good range of motion in hands, wrists, elbows, shoulders, spine, hips, knees, and ankles. Mental status is alert and cooperative. Thought processes are coherent, and insight is good, oriented to person, place, and time. Cranial nerves 2 through 10 intact. Good muscle bulk and tone. Strength 5 out of 5 bilaterally. Rapid alternating movement and point-to-point movements intact. Gait is stable and fluid. Pinprick and light touch sensation intact. Romberg negative. Reflexes tested were normal.